Hello, today I'm going to teach you how to properly seat a patient. This is really important when it comes to first impressions, especially if it's a new patient within the office. So let's get started. The first thing that we are going to do is check all of our boxes. This is very important before bringing a patient back. So before we bring our patient back, let's double check the room. Is everything set up? So a couple of examples here. This is an unprofessional setup. So if you look over here, everything's just kind of thrown around. Nothing is organized. Patients pay a lot of money for treatment. So we want to make sure everything looks neat and tidy and overall clean because we're also working in the mouth. Not to mention that the keyboard and mouse are contaminating our area by just being there. And lastly, our counter looks a hot mess here, so just make sure that we clean this up before bringing the patient back. This next setup is of a root canal. It's pretty good. Everything looks neat and tidy. We are missing a couple of instruments though, so let's just make sure that we grab those before bringing the patient back. This last setup is of a crown, and it is a perfect setup. We have everything nice and neat. We have all of our instruments, and our counter space looks absolutely beautiful. It looks ready to bring a patient back. All right, so the next box that we want to check is making sure that we have the right patient and the right name. Always double check the parentheses on your route slip. Make sure you are saying the right name. Their name could be Charles and they go by Charlie, or they could go by a completely different name. So just double check that before grabbing your patient. And then the last thing you want to do before grabbing your patient is making sure that their chart and their x-rays are up and not the schedule. That is a HIPAA violation and we don't want to get in trouble for that. So just make sure you have their chart up as well as their medical history and their x-rays. Now we're ready to grab our patient. So when we go to grab our patient, make sure that you go up to your patient, address them by their first name, and say everything with a smile. It makes everything more inviting. And then from here you would have them follow you. All right, so let's get into the do nots. So do not do this.
Brittany?
In this example, I had yelled her name before seeing her. I am not smiling. And then also my posture is very slouchy, and everything I had done is pretty unprofessional.
Brittany? Yes.
In this example, I had yelled her name and just stood at the door and waited for her to come to me. Please don't do this either. As you're walking your patient back, ask them about their day, how everything's going, make some small talk. When bringing your patient back, advise them of where the coat hanger is and if they have any belongings to hang up. And then have them whip out their phone and leave us a review when they get comfortable. It really helps us out. Next, we are going to introduce ourselves. When introducing yourself to a patient, state your name, also your title, and more specifically, which doctor you'll be working with today. And here's an example of that.
Hi Brittany, my name is Kira. I'm one of the assistants here. I'll be working with the doctor today.
Also, a couple of things to note here. My body language is facing towards Brittany. I'm giving her my full attention, and I am saying everything with a smile. This is incredibly important when building a relationship with our patients. From here, we'll get the patient set up. So we'll create some small talk, be personable, make it short and sweet, and make sure that the conversation is always aimed towards the patient. I'll give an example of this.
How's your day going today?
Good, how was yours?
Pretty good. Doing anything fun this weekend?
Selling Girl Scout cookies with my daughter.
Nice, nice.
Yeah,
She's selling a lot?
yeah, she's doing okay for a 6-year-old. Do you have any plans for this weekend?
No, just hanging out with the family, all that kind of fun stuff.
Oh.
place this on here.
From here, one of three things will happen. One, if the patient is here for a specified treatment, like a root canal fillings, always confirm the treatment with the patient. I'll give examples of this here.
All right, Brittany, so today it looks like we're doing a crown and a couple of fillings. Does that sound right to you?
Yeah.
Okay, did you have any questions about anything?
No, I think we're good.
All right, we'll get started here.
If treatment is right, go over any questions, confirm medical history, place topical, and grab the doctor. Now, if the treatment is not right, answer any questions that the patient may have. Ask the patient if they want to continue with the original procedure or if they want to make changes, and then make sure you inform your doctor and write on the route slip any changes.
So today it looks like we're doing crown and fillings. Does that sound right to you?
The crown? What's that? I thought we were just doing fillings today.
If you only want to do the fillings today, that's okay too.
Okay. I just wasn't prepared financially to pay for a crown
I
today.
understand, yeah. We can totally accommodate for that. Give me 1 second, I'll be right back.
The second thing that could happen is you have a limited exam. If you do, ask their symptoms. Always, always, always take a bite wing, a PA, and some intraoral pictures before leaving the room. This shouldn't take very long at all. This should take really no longer than 10 minutes so that the doctor can come and evaluate and you can start treatment if necessary.
Hey Brittany, what brings you in today?
Yeah, I'm having some pain on my lower left side. When I chew, sometimes it's a little sensitive. I notice a lot when I'm eating something sweet though.
Okay. Is it sensitive when you're drinking anything cold or anything like that?
Not that I've noticed.
No. And then how long has this been going on?
Maybe about 2 or 3 days.
2 or 3 days? Okay. Has it been keeping you up at night?
No, not right now.
Okay. So what we'll do is we'll take a couple of x-rays, gather some information, and then the doctor, and then they'll come in, kind of discuss a little treatment plan if needed, and then we'll go from there, okay?
Try not to promise the patient anything and try to use a lot of neutral terms so it doesn't really get the patient's hope up if we can't do same-day treatment.
Okay?
Okay, sounds great.
Last thing that could happen here is somebody's asking you to see their next patient for them, which is totally fine. Check the procedure, make sure that they don't need any x-rays, and if they do, go ahead and take them. And then inform the patient that somebody will be in with them very shortly.
So the doctor will be in a couple of minutes, and then I will be right back. Thank you.
Before leaving any of your patient's room, always offer hospitality. Always offer a water, a juice, a blanket, pillow, anything that can make them more comfortable. People are very anxious when they come and see us, and we just want to make sure that they are feeling comfortable.
Can I get you anything in the meantime, like a water, juice, blanket, pillow, anything to make you more comfortable?
Pillow would be nice.
Pillow? Okay, I'll be right back.
Yeah.
Also, if your doctor is taking a while, keep checking on your patient. Make sure they're doing okay.
Hey Brittany, it's taking the doctor a little bit longer on his last procedure. Is there anything I can get you in the meantime? He should be wrapping it up in about a couple of minutes. Okay, I'll be right back. Thank you so much for your patience. I do apologize for the wait.
I know this probably seems like a lot of information, but no worries. If you have a question, you can just let me or another team member know, and we would be more than happy to help get you acclimated, especially to our office. Thank you again for watching, and on to the next video.